Good afternoon, everyone, and thank you so much for joining us today. I think if I can still say on January 15th, Happy New Year to everyone. I should also say good morning to some of you. I do have quite a few of you on the Pacific side of the world that is also or on the West Coast that are joining us, so thank you so much. I'm Jenny Jenkins, and I'm the Executive Program Director for Global Healthcare Resources, and I have the distinct pleasure to be bringing you one of our I think most exciting webinars of the year. It's the Crystal Ball webinar. But before I jump into that, I want to talk about, I want to engage you in a polling question. So we're going to start this poll now. And essentially, what we're asking is, what most drew you to attend this webinar? Was it looking to reduce your high claims cost? Looking to improve the health of your employees or your employer's employees, looking to attract and retain top talent for your employers or for your own business, and then, of course, looking to learn more about ACA, opioid and alcohol addiction, as well as pharmacogenomics. So we're going to start the poll now, and you'll have about 20 seconds to answer the question. So it has started, and if you look to the right, you'll see a little arrow that says polls. And if you just open that little arrow, you'll be able to answer. And I see many of you are doing so. So thanks for engaging. Looks like we have just a few more seconds left. So the poll is closed. And results are in. So more than 50% of you are looking to learn more about ACA, pharmacogenomics, and the opioid and alcohol addiction, followed by a close group looking to reduce high claim costs, as well as looking to improve the health of their employees, and some are looking to attain and retain top talent. But the most popular, I'm sorry, I didn't read that right. The most popular is obviously to learn more about ACA, the opioid and alcohol addiction, and pharmacogenomics, followed by looking to improve the health of your employees. So that's great. It's a good way for us to understand and determine, exactly what you're looking to do. And so, of course, I am going to go right into the presentation. First, I'm going to tell you a little bit about GHR before I introduce our panelists. And at GHR, we are, one of the premier corporations that brings businesses together through education, training, and connection. We're one of the world's most kind of authority on the business of health. We work with some of the very largest employers talking about these issues, and we're really blessed to have the group of people that bring their thought leadership to the table. We work with about 2.6 million professionals in the area of health and well-being, and so our reach is, made up of magazine subscribers, as well as our social audience and our email database. So we're able to communicate on a lot of levels with our followers, and so it sort of helps us to gain perspective from a large audience. And so with that, we also bring certifications to the table. Shout out to all my certification participants out there. I have CCWS on the line. I also have Chris on the line. So those of you that take our programs, this particular seminar is the 2019 Virtual Summit of January, and it will count towards SHRM credits, CCWS credits, as well as Certified Healthcare Reform Specialist credits. So each of you are corporate wellness specialists, our healthcare reform specialists. It also will count towards CVBS, which is our Certified Voluntary Benefits Specialist, and of course the Self-Insurance Certification Specialist. So those are the programs in our portfolio. Virtual Summits, the reason we brought these together in 2019 is so that we could share with you the content direct and at your place of work, where you can step away from your day-to-day and actually get the knowledge right away and, fast and on demand. We're also going to share these summits, after the conference, after the virtual summit. Few housekeeping notes. I did already mention that it counts towards SHRM, CCWS, CRISP, and SICS. We have audience polling, which you guys got to see. Those of you that participated, great, you know where you're able to look at it. Again, do look at the right side of your screen so that you can participate in the polling. I do have a download today that you'll be able to download, and there's a little arrow that talks about your download. So we do have a special download that you can download if you'd like to. We're going to have open Q&A throughout the event. Each session that we have is a little bit different. One is a fireside chat. Another is a presentation followed by an Ask the Expert session. And then finally, we have a presentation followed by a Q&A. So we're excited to bring those 3 different types of sessions to you. And we will be recording this session as mentioned, and it'll be available about 48 hours from today. For those of you that are my certified corporate wellness specialists and certified healthcare reform specialists, you'll have access to this in your learning management system under your CEU tab, and you can go back to it again and again to kind of gather the details and get some of the statistics directly from it that you need. So I have one more polling question before I introduce our first speakers. Would like to know today, what best describes your role? And I'm asking that because I find that some folks are in a wellness role, but they're also in an HR profession, or they are the HR director, but they're also the CFO. And so I'd love to kind of see the different roles that we have. So we're going to go ahead and open the poll now. And we'll have about 20 seconds for you to answer it. Thanks, everybody's answering it. I appreciate it. Okay, results are in. 49% of you identify as your HR and wellness professionals, followed by 25% of you being agents, brokers, and consultants. 6% of you are in the CFO, CEO, COO position. 17% of you are health and wellness providers, and 7% of you are insurance professionals. So we've got a really good mix of folks on the line today, and I think you're going to learn a lot, and I'm excited to be able to bring this sort of glimpse into the future, the crystal ball. Everybody on this call has a crystal ball, and they use it. But really what we're going to be talking about is sort of how can this affect your organization, each topic, and we'll gain some awesome perspective from people that have been doing a lot of work on this topic. So without further ado, I'm going to get started by introducing the opioid and alcohol addiction crisis. How will it affect your organization in 2019 and beyond? This presentation is a presentation that we'll have the pleasure of having Rosa Novo from MiamiDade School District, as well as Karen Van Coolel from Florida Healthcare Coalition, and Dr. Barry from Recovery Unplugged, and they'll be talking about the best methods for understanding the crisis and how to detect that you have an issue and what you should do if you detect that you do, and other topics in between. So without further ado, I'd love to hand it over to Karen Van Coolel. She's CEO of the Florida Healthcare Coalition, and we're excited to hear what your studies and research and all the time that you put into it has developed for this presentation. And so I will hand it over to you.
All right, thanks very much, Jenny, and Happy New Year to everyone. I'm Karen Van Coolel with Florida Healthcare Coalition, and we are a nonprofit business coalition on health. And so we work with 125 employers who have employees in the state of Florida, and certainly employers play a very important role in promoting the health and safety of their workforce and also managing risks. So over the last several years, with the continuous media coverage about the opioid crisis in the United States, the employers were coming to us at the coalition and asking what they could do to reduce opioid addiction and abuse. What we had been seeing in the state of Florida was a very intense effort around getting naloxone in the hands of first responders, dealing with the folks who are already addicted and overdosing. And we wanted to really focus on prevention as best we could. So we threw ourselves into the mix at a state level. There wasn't a strong business or employer presence. And we're really glad that we did that. We learned a lot by convening the employers over a full year. And today, Rosa Novo and I will talk about that effort to address the crisis. So we can go on to the next slide. Just a little bit more about the Florida Healthcare Coalition. As I said, we're a nonprofit and we work with 100+ employers. We represent about 2 million lives in the state of Florida, so that really gives us a lot of leverage in making change. We're also a really captive audience. So if there's a new approach, a new benefit design, a new engagement strategy, we can do that. So our primary focus is improving the quality of care in Florida, but we work around a lot of other issues, in particular patient safety. We are the regional leader for Leapfrog. So if you see the hospital safety scores, which come up a couple times a year, we coordinate that in the state of Florida. We are a research and education entity, so we do a lot of demonstration projects, and all of this really makes us a really tight and comprehensive learning community. So the employers share amongst themselves, we share with them, and then we push it up and out through the network of coalitions across the country. So there are about 50 organizations like ours across the country. Some of them are state level, some are multi-state, some are municipalities. And if you haven't engaged with your coalition, I would suggest that you do that. And if you need contact information, I know Jenny can get that information to you through me. So happy to share on that. So we can go on to the next slide. So our employers really had legitimate concerns about privacy and protection of PHI, personal health information, and possible violation of that confidential relationship between patients and providers. So they were asking us a lot of questions. Is it really any of their business what medications the employees were taking? Do they really have a problem in their own organization with opioid medication abuse? And how could they even make a dent in helping to prevent or mitigate opioid abuse? What we put together in order to answer those questions and others was something that we called a Better Pain Management Initiative. It was a collaborative of the employers over a year, and we were really very dedicated to addressing, this very serious patient health and safety issue here in Florida. So I can go on to the next slide. So these are some of the overarching questions that we addressed. There was a lot of concern about how the employers could get the right data to be able to monitor the situation. So that was a big area of concern. But what are other signs that you have a problem in your place of business? How is it impacting the workers and their productivity, the morale of the workers, and certainly the quality of work being undertaken? Are there particular strategies and policies that you could implement to reduce the chances of opioid abuse and addiction? So today we're going to present, as I said, some of these collaborative learnings, and Rose is going to get into more detail about some of those. This presentation that we're doing in about 20 minutes, Rose and I have done a few times, an hour plus, and we have created different toolkits and materials, and we are happy to share those if you're interested in receiving them once you've heard what we have to say today. So we can go on to the next slide. And again, what did we learn? I will say that it is a continuing process. We have not stopped learning in this space, and we're going to talk about things like education and policies and data and what you need to do with your PBM, with your health plan. But right now, the stage that we are at is that the employers really need to understand what is best practice for treatment. We've worked on the prevention. The employers have made very significant changes to their benefit design, to their reporting, to their policies. And now they've come back and said, okay, so we did what we could do to prevent hopefully further abuse and addiction. Of course, we know we can't catch everything, but what's the right way to treat these folks and go to the right centers? So hopefully we'll be able to come back at a later time and address that, and we'll talk to you for now about what we've been able to learn to date. So why don't I pass it off to Rosa and let her pick up the next several slides.
Sure. Thank you, Karen. Well, good morning, I guess, to some of you, like Jenny said, and good afternoon. Happy New Year to everyone. Thank you, Jenny, for this opportunity, and Karen, to continue to carry, the torch for the large employers. We've learned a lot, by, like Karen said, using the different toolkits, but there's so much still to learn and to do. And here are some of the things that we, Miami-Dade County Public School, have been focusing on. I first want to share with you how large we are and what healthcare means here in our district. We are close to being the third largest district in the nation. We cover 72,000 lives. Our healthcare is running at $360 million. And our focus is not only our employees, but our students. You can only imagine the safety of our students, how important it is. So some of the things that we've been focusing on, and I'm not going to read all the slides word by word, but just to highlight some of the things included in the slides, we've really been looking at the data that historically has been provided by our healthcare carriers, and really focusing in on specific collection of specific data. When you talk about prescription, yes, you get a lot of reports on prescription, but how about, the duration and the usage of those specific medication? How about tying them into hospitalizations or medication that are prescribed after ER visits, which seldom you come across an employer who really is focusing on that. So these are some of the things we're looking at as an employer with our ASO. And is really giving us a different perspective of what is out there and what opportunities, we need to be looking at. Additionally, all of our benefits are negotiated at the table with our unions. So something we've been working on is, you'll see in the last bullet there, is looking at pre-employment, meaning post-offering but pre-hiring, drug tests and every type of test possible that is tied to a position. Like, we have specific requirements here when it comes to bus drivers, to cops, because we have our own workforce. But I'm sure a lot of us here on the event today participating have unique needs and unique groups of employees, and it's really focusing in on all those different employees when it comes to the pre-employment, not only from an opioid, but from a workers' comp standpoint. And then, as is stated there, look at random testing for cost. For cost is something that we have focused on, and post-accident, we have a lot of drivers that if they are sent to the doctor and they are, tested and it comes out positive and they are provided with a course of treatment, they don't follow it. We have board rules that allow us to take action. We are here for our employees in supporting their needs, but our number one goal is to provide a safe environment for our students. So this is huge for us. Next slide, Jenny, please.
While you're switching to this slide, I just want to say that make sure that your drug testing does include opioids. We found out that in many instances it did not.
Yes. And I'm going to go a little bit later on deeper into the different types of testings that we've been looking at some of the challenges. I think the next slide is what else should employers require? It could be perhaps the one prior, no? Okay. Are we on the right slide? Now go back? Oh. I don't know if we went too far. Okay, go one left, one prior. The one before that? Okay, there we are. So some of the things that, thank you, Jenny. Some of the things we've been focusing on and implementing as of last year, and definitely because we are on the process of releasing an RFP for next year, so these are definitely things that we will be incorporating, is requiring PAs, prior authorization. And I'm sure a lot of you, and if not, you may be, you're now familiar with some changes here in the state of Florida that happened last year with regards to dispensing, QLs, quantity limits, and prior authorization being needed. But it's not only prior authorizations on those medicines as defined by the state needing them, but it's taking another step into really, again, looking at the data and other medications that could be addictive, making sure that they do have that PA or step therapy and QL when appropriately that can be implemented. Another thing is drug monitoring databases. Yes, there are requirements, out there, which retail stores, the large chains do follow. But like a challenge for us here are the independent pharmacies. So having a conversation with our ASO for those pharmacies that are not part of the large chains that do share that database to see how we can definitely have a monitoring process in place to assure that our employees and our dependents are not hopping from pharmacy to pharmacy and getting those multiple medications that we know, unfortunately, what the end result of that could be. Next slide. Okay, thank you. So a lot of conversations around post-surgery and dental care. Post-surgical, there's a lot of opportunities besides just writing a script. And we've heard about different medications that are out there, different, procedures to follow. Something that we definitely are looking at and we've started to work on is an integrated platform. Typically, the way healthcare plans work is that a non-participating provider can prescribe a prescription and be covered under the plan. And you really have no way of tying that back to a provider to do that outreach. So what we're looking at is bringing in an integrated platform. For us, what that means in the case, as indicated there, dental surgery, which is very unfortunately commonly seen, that you get, not only 30 days, but a 4-month right refill, is to, even though if the provider is not in the network, somehow flag that prescribing provider and have a reach out by the carrier to that provider in hope, not only to reduce the in-network, but also the out-of-network provider using in-network pharmacy benefits. Something else is the abuse deterrent formulations. And this is nothing new. This has been in the industry, it's a very old term. And some of the challenges have been the cost, right? And the limit on reimbursements on these medications and all these processes. But definitely having continuous conversations with our healthcare carrier to see what opportunities are there. And not only at the physician, but something that we in the industry, you don't see employers really focusing a lot, is in abuse deterrent formulations when it comes to hospital-based utilization or discharge or post-discharge. So that is something that we're looking at. We're looking at maybe working through our ACO partnership with our healthcare carrier, that if it's an attending physician of the ACO, the one that admitted the patient, have some internal conversations through their committees at the ACO and be able to follow that patient once they're discharged from the hospital. Next slide, Jenny, please. Thank you. So again, surgery, we're looking at different options, really focusing at the hospitals. Typically, when you're negotiating contracts with your healthcare carriers, you're looking at a formulary. A formulary is typically, for medication that you're going to be picking up at a retail or maybe mail away, home delivery, but seldom you talk about hospital formularies. So really focusing on hospital formularies, because that's where a lot of times, unfortunately, this addiction starts or this habitual behavior starts, because there's a need, the medication is given, they assess, they prescribe it, you start taking the medication, and then it becomes, the new way of life, unfortunately. Working with your EAP is something that for us has been extremely, extremely effective. Last year alone, we tripled, unfortunately, but we did increase the awareness through a lot of these webinars and a lot of these, educational opportunities. But we increased by 3 times the number of visits that our employees had at our internal EAP in compared to 2017. As a result, we have added this year, effective 1/1/19, 3 additional visits to in-network providers free of charge to our employees to encourage them to go seek that care, that support that is needed. Additionally, we are working with all of our school sites. We have 400 schools and 500 locations, and they're all divided by districts, which are represented by a different board member. What I'm doing is opening wellness centers in each of these districts where we will have a wellness mental health facility where our EAP team can travel to these facilities and provide, that clinical support. A deterrent, as we know, at times is not only cost, but also traveling. So want to make sure that our employees have a lot of access to care when needed and when appropriate. The reversal agent prescription is something that you really need to be looking into. It's unfortunate that we need it, but really have a conversation with your healthcare carrier. It's new, not fresh out of the box, right? It's not a 2019 new type of thing, but it hasn't been around that long in the industry. But definitely have conversations with your healthcare carrier about covering it. To make sure that when there's a need, and like for us with our students, unfortunately, we just went through the awarding of an RFP for mental health and for our students for services, and we do have a number of students that unfortunately have needed, this medication. Finally, in the screen, consider opioid alternatives, as stated before. There's other things you can do before prescribing a medication. That's what a doctor should be thinking of. And today it was in the news in the state of Florida, I believe is from St. Petersburg, the senator, they're talking about releasing a bill allowing psychologists to prescribe medications. Because by 2025, they forecast having less and less psychiatrists available, and the need being more, than what it is now, obviously. So something that we're working with our healthcare carrier is coming up with a plan design where a lot of the things indicated there, like massage therapy, physical therapy, acupuncture, relaxation therapy, all these therapies would be covered by the plan at a minimum or zero copay to the employee. Incorporated as part of the step therapy. So prior to getting an opioid, prescribe and dispense, let's try these alternative methods of therapy. And if they don't work, then we proceed to the medication. Next screen. Thank you. So back to policy. We reviewed our policy a little bit over 2 years ago, and Karen mentioned before the testing. And the testing becomes a little bit of an interesting process and complicated because the appropriate test for the appropriate drug that you're testing, it depends on when you're doing it and where you're doing it and who is doing it to really get an accurate result. So urine testing, for example, we do drug testing, we do. Again, we have a police force internally, which brings in other conversations as requirements. So my comment really when it comes to testing is understand the employees you have or the employees you provide service to, right? Because some of you may be brokers, as mentioned, or as the results of the survey at the beginning. Not everybody is a benefits director or HR. So look at the employees that are accessing the care. See what requirements are out there statutorily or by contract, by labor contract, and then really look at the opportunities of testing. Testing is something, like Karen said, is very important, but it's something that we always, as employers, don't focus on, and mainly after someone has already been employed. Next screen. Thank you. So something we really have been focusing as well last year, we started this movement back in 2017 of increasing, the mental health awareness, is really providing our supervisors with the tools. We have, as I stated, 400 schools. Every school has a principal and a minimum of 2 to 3 assistant principals. So we have embarked on this mission of providing everyone with the opportunity of going through the mental health first aid training. Not sure about fully certifying them. I did it. Sometimes when you certify people, they think that they are physicians, they're in power, but definitely give them enough information to be able to assess the early stages of a situation. Also, we have ongoing, on an every month basis, district-wide training for our principals and our high-level administrators by our internal EAP department. And we bring in clinicians, we bring in a lot of vendors, and we have a lot of face time with our employees from the standpoint of education through our partnership with our healthcare carrier. Fitness for duty. Well, federal and state, what we all know is we are in a very interesting industry. It's constantly changing. So it's something you have to make sure, and the state of Florida, God knows, is very interesting. It's something that you have to stay on top of it and make sure you speak with your benefits consultant or your healthcare carrier to make sure that you know what's the latest. Fitness for duty, for us, is very important. And again, it changes by group of employees. Fitness for duty, like for our police force, is very different than our transportation team or our teachers. So my message when it comes to fitness for duty is to verify that you have the correct testing done by the correct provider at the appropriate time. For us, this is very important. Like I said, children's are our primary, real estate here and the most important one. So providing a safe environment, which nowadays, it becomes a challenge in our mind. We send our kids to school. Are they safe or not? We want to assure our parents that our students are safe. And every little bit, everything that we do, even from the standpoint of benefits, reassures that. And fitness for duty is a big part of that conversation.
Okay, I'm back.
Employees. It's Karen's turn. Thank you, Jenny.
All right, thanks, Rosa. So empowering employees to have a conversation with their provider is very, very important. That's part of the bigger picture of what the Florida Healthcare Coalition has done over the last several years. We've worked, and many of the other coalitions as well, with a campaign called Choosing Wisely. And it's a program that helps employees know what to expect when they're facing a test, a procedure, treatments, surgery. And if you are not familiar with Choosing Wisely, make a note and check it out. It had been run by Consumer Reports for a number of years, and now it is with the ABIM Foundation. So we can provide resources for that. But these kinds of questions that are on this slide are really based on what we've learned through Choosing Wisely, and to teach employees to feel comfortable and empowered to have a dialogue with their provider. What we also did is work with the providers and make sure that they allow the patients to have that kind of time to have this very important discussion, or even better, proactively address these issues. In fact, some of the providers we've met with have gone ahead and posted the questions that they are expecting the patients to ask them in the waiting rooms and in the exam rooms. So that's a signal to the employees that it's okay. I can ask them these questions. People get very intimidated, as well, in the situation with a doctor. So important questions. How much discomfort is usually associated with this procedure? People have different thresholds of pain, which we all know, but to actually have that conversation with the doctor about it, because maybe you don't need to have medication at all. How can I minimize the need for opioids? People need to understand that that's a very important question. And Rosa talked about the alternative modes that are available, and we're encouraging employers to cover things like massage and acupuncture. What non-opioid options do I have? Well, those are a few, but also there is a drug that can be used during surgery that is an opioid alternative. And if it's injected in the surgical site before they close the patient up, that individual, if the surgeon's done it correctly, won't need opioids for about 3 days. And that's that critical time period when people are experiencing the most pain. So some other questions: what can help my recovery? I mean, simple things like ice, for example, just, have that conversation. Tylenol, Advil. And as I said, everybody's different. Everybody has a different threshold for pain. So ask the doctor, what do you need to know about me, so that we can come up with a pain management plan that fits my expectations and my unique circumstances. And there's always a concern when those meds wear off. How am I going to handle this? People really worry about that. I'm down to a couple of pills. Have that dialogue with the provider. So it does take some work on the provider end to get them to, create an environment where the patient is comfortable having that conversation. Next slide.
Sure. Karen, if I can add something,
Sure.
because something that we're working now at the school board with our healthcare carrier is that as soon as a request for a pre-authorization to a hospital visit for a surgery comes in, that an outreach is made to the patient, to the employee, letting them know some of these things that you just mentioned, letting them know you have the right to ask questions, you have the right for alternative medicine, you have this, find out, because a lot of times, like you said, they really don't know. They don't know what to ask. They're nervous as it is because of the unknown, the outcome of a procedure, and even those that do know what to ask, they forget. So that outreach has become something of very, very valuable for us, and has been well received by our employees.
Okay, well, this is our last slide, and I know we're running out of time here. So in addition to arming the employees with the right questions and the resources, they need to know how to store meds and dispose of them properly. They need to understand that they shouldn't save or share medications. A lot of horror stories around that, so we won't get into the detail on that. I know you've all heard stories, and it's very compelling, but explain to them how they need to do it and where they need to do it. It's very, very important that they understand their own workplace policies. Rosa covered a lot of that a few minutes ago, in case they are legitimately taking opioids, so that there's no confusion about whether and how they can perform their job. Again, I see on here the questions to ask providers about their own treatment and pain options are really important. That needs to be shared by the employer. And these are not one and done kinds of activities that the employer needs to undertake. I heard somewhere not that long ago that you need to tell someone something 11 times before they actually hear it and learn it. And I joke around about how that explains a lot about conversations I've had with my husband and kids over the years. But all teasing aside, making this education part of the ongoing messaging that the employer provides through their wellness programs, in their newsletters, in their portals, in conjunction with their PBM and their health plan is very, very important. So it's very comprehensive, the approach, as we've talked about the education, the policy, the benefit design, and it's complicated, as Rosa indicated, but definitely doable and worth the effort. So I'm going to stop there. I know Jenny wanted us to take some questions.
I definitely do, and I do have one question. Before we introduce our fireside chat, which we have the pleasure of having, as I mentioned, Dr. Barry Ryman from Recovery Unplugged joining us at that time. But first, I have a question that was dedicated to you, Karen, and basically, how did you address liability and legal issues with Better Pain Management Collaborative?
So we had a summit December a year ago, and really talked about that issue for most of the day. We brought in an attorney from the Federation of Defense and Corporate Counsel to talk about existing litigation around who has liability in cases where opioids have caused injury or death, and he made it very clear that there is liability in the employer space, and the best way to do it is to make sure that the policies and procedures are clear, that the benefit design supports alternative pain modalities and limits opioid scripts in terms of duration, that the education that I just finished talking about is provided to the employees. And probably most importantly, he talked about the data, and we talked about that early on just now, monitoring the data and reaching out proactively to patients and providers when that monitoring reveals excessive prescribing or use, and that you're taking action. What I do want to add, what was very interesting, here he was getting up there and telling everybody, what they need to do to, limit their risk and their liability. And he had this revelation. He said, I have no idea whether our own large law practice has put all this in place. And so he immediately followed up after our summit with bringing us to their annual meeting, and there were probably 600 national law firms that were, across the country, telling their clients what they need to do to protect themselves, to make sure that they themselves were doing the same for their own organizations. So it really, was an interesting opportunity to expand that knowledge base. But, there were a lot of employers who really didn't feel like, once you talked about the health plan and the PBM and maybe the doctors and the hospitals, that there was much liability left at the end of the day. And he certainly shared that, a lot of these employers have deep pockets as well.
Interesting. Thank you for that. There's a question here for you, Rosa. How does Miami-Dade County Public Schools empower employees with the information they need to make an educated decision?
We, like Karen mentioned, we incorporated not only in our benefits communication strategies around open enrollment, but on an ongoing basis through our wellness initiatives. We have Wellness Wednesdays that we've incorporated. Every Wednesday there's an event at a school, at a site, and we have incorporated a lot of this information that we shared here today. We also have posters that we have sent out to our schools. We also have events with our union leaders, like this Thursday we have a huge union stored event, which will be bringing some of our collateral pieces on behavioral health and addiction and overall wellness. So we try to incorporate it, not only tying it to open enrollment, but in every opportunity where there is an encounter with the employee. Not only give them the material, but have a chance to, explain the material that they're receiving.
Excellent. Thank you for that. I think it is important to have, as many different kind of vehicles for giving them information. So covering it from, live events to posters to emails to newsletters to probably webinars. It's all really, really great stuff. So thanks for sharing. Now I'd really like to jump into our fireside chat. And in this, we have a few questions that are sort of geared towards all of you. And I'd like to reintroduce Dr. Barry Raymond with Recovery Unplugged. He's on our line today. Hello, Dr. Barry.
Hello, guys. Thank you for having me.
Excellent. Well, it's nice to have you. And, as we look at all of the different areas of the crisis of opioid and alcohol addiction and how to kind of avoid that process, we know that there is still, a crisis at hand, and looking at ways to alleviate some of that through, a recovery plan and back to work plan is important, I think, as well. And Karen and I had talked about that before, and it's kind of like, okay, what next? What is our responsibility as employers, and how do we help them? But I'd love to jump into a few questions for you, and of course I've got some for you, Rosa, as well as you, Karen. The first one for this fireside chat is for you, Dr. Raymond. How does a psychologist specializing in addiction treatment like yourself conceptualize or break down the current opioid crisis?
Wow, that's a great question, and I'd be remiss to say that you hear it said that there's an opioid epidemic going on, and I refer to it more as even a pandemic. If you look at the recent statistics, there's 72,000 people every year that are dying from an accidental opioid overdose, and that's not alcohol related, that's not stimulant related, that's just an opioid overdose. And I think in Vietnam, there were a total of 58,000 Americans that died. And we're looking at just a crisis upon crisis when dealing with these opioids. And, you know, my best judgment where I look back where this really started is back in the middle of 2000, you know, there were these pain clinics that were popping up everywhere. And it got to the point where there were mobile MRI units sitting outside nightclubs for people to go in and get a fake MRI, and they would bring it to this pain clinic, and they would walk into the pain clinic, and there would be an unscrupulous physician in there, you know, writing all these prescriptions for OxyContin. And, you know, the feds eventually, I think around 2007, came in and raided all of these pain clinics, and all of these people who were addicted to these pain medications that used to pay, you know, $5 a pill for, all of a sudden went up to $30 a pill on the streets because they were much harder to get. And, you know, something that isn't often mentioned too is, you know, the use of needles, you know, when it comes to using opioids, where, you know, 20 years ago, if you used a needle, you were a quote unquote junkie living under a bridge, you know, in downtown of any city in America. And when these pills were introduced, because they had a controlled release tab on them, they needed to be crushed for the person to feel the effects of the opioids. So needles started to become much more mainstream. And believe it or not, when the federal government came in and closed all these pain clinics and the pills became much more expensive on the streets, in order to avoid getting sick from the withdrawals, suburban America turned to heroin. And to me, that was the start of this epidemic. You hear it said a lot with big pharma and how big pharma is responsible for this epidemic. And in a sense, you know, that's kind of true when you look at places like Purdue Pharma. So judging by what's going on today is just mass hysteria. You know, it's equatable to, you know, the cocaine days of the 1980s, but people were not overdosing on a daily basis and dropping dead from doing cocaine. Yes, obviously cocaine is very harmful and heart attacks happen and things like that. But, you know, what's happening today is the synthetic drugs like fentanyl and carfentanil are now being introduced into society. And, you know, they're 50 to 100 times more powerful than morphine. And these people who are ingesting these drugs don't even know what they're getting, and they're overdosing. So.
Yeah, it is a pandemic. Thank you for that. You know, what efforts as a recovery center is Recovery Unplugged undertaking to address, you know, the opioid crisis?
Sure. So if anybody on this, you know, webinar is not familiar with Recovery Unplugged, we have facilities in Florida, Austin, Texas, Annandale, Virginia, just outside DC, and we're opening in Nashville, Tennessee. We offer all levels of care, and it starts out really with the detox process. So, you know, when somebody is hooked on these opioid medications and they decide that they want to stop, if they decide to try and go cold turkey, they wind up getting very sick and could have severe consequences from doing that. So we are a medical detox facility where the client comes in and they're slowly tapered off of these medications they're on over about a week's time period. And we offer all levels of care, from medical detox to true residential to partial hospitalization to intensive outpatient. We look at every person as different. We look at their history. If we're encountering somebody now, you know, the big push has become for MAT, or medication assisted treatment. And I think initially, one of the issues personally, and I'll just be transparent with you guys, is I'm not only a doctor of psychology, but I'm in recovery myself for almost 23 years. And, you know, I was brought up in what was considered, you know, abstinence. And even though that's how I choose to live my life in recovery, you know, there's been a big push for medication assisted treatment and the advent of Suboxone. The issue I've had with Suboxone is that when you give somebody Suboxone, you're kind of allowing them to take control over what doses they want. So over the last few months, there was a new drug that came out that is FDA approved. It's called Sublocade, and Sublocade is a 30-day long, it's a shot that lasts for 30 days, and it slowly releases Suboxone into the system. So if you have if we have a client who's come in that has had multiple failed attempts at both treatment and recovery, they have a high propensity of overdosing. As soon as they leave treatment, they would be a candidate, you know, for the MAT track. One of the things that we've done over the last 6 years that we're proud of is we are the largest Vivitrol provider in Florida. And for those on the call that are not familiar with what Vivitrol is an opiate blocker. So once somebody goes through our program and they're getting ready to step down to the intensive outpatient level of care, if they've had any history whatsoever of opiate use or abuse, they're administered a shot called Vivitrol. And what it is, it's a blocker. So it actually blocks the opioid receptors. So if somebody does have a weak moment and they decide they want to relapse and they try to use an opiate, they will not feel any of the effects whatsoever from that drug. So it's more of a deterrent. It also helps with craving control. Recovery Unplugged, we pride ourselves on being on the cutting edge of treatment. We have empirically validated research that's been done on us through Nova Southeastern University over the last 3+ years. We're very excited about the treatment center we have, and I think the thing that makes us the most different is music is really used as a catalyst to connect with our clients. So one of our owners was a former member of the band Aerosmith, so we use music on top of trauma therapy and dialectical and behavioral therapy and all that good stuff, but music is really the centerpiece of our program.
Right, I think that's a great key differentiator. And when you're talking with people like Karen and Rosa and engaging with employers, what do you recommend for them? In addition to the things that we see Karen and Rosa doing, what are you doing, say for large employers to help them better educate their employee population?
Well, and that's a great question. Thank you for that, Jenny. What we've done is we've met with several EAPs across the country. I happen to be talking to you guys right now from San Jose, California. I'm actually speaking tomorrow at Samsung's corporate headquarters for their human resource team, their employees, and their EAP, which is super cool. So one of the things that we really try to instill is look for the warning signs. Unfortunately, there's still a stigma attached to the disease of addiction, and it's really a disease. It's not a moral dilemma. It's not about a bad person needing to become good. It's about a sick person needing to get better. But I think there's such a stigma attached, and employees are so afraid to get honest with the human resources department because they fear retribution, that they're going to lose their job if they talk about having an issue. So I think it's important from the jump that employers allow their employees or let their employees know that, listen, if you are struggling with this illness, please feel free. We have an open door policy. Come and talk to us about it. There's warning signs that have already been brought up on this call. Somebody calling into work, somebody looking disheveled. And then, one of the things that for me has been a differentiator is what happens when it is a senior level person that is not acting right and is noticed by a lower level person. There's a fear that if that lower level person was to report anything, the senior level person, again, may find retribution and take their job. So I think there just needs to be more understanding and more compassion throughout the workplace, where they understand that this is a disease and not a moral dilemma. And I think that employers, need to recognize that, if an employee needs to take time off to get this right, I mean, you're only going to be getting back a more effective employee in the long run, and we're going to be keeping more people alive. So I think just the destigmatization of being an addict and being very open and being forward thinking when it comes to actually treating and helping your employees.
I think that's great. And maybe Karen or Rosa, from your perspective in dealing with your EAP, is that something that, is something you're looking at to, better, achieve communication with your employees? Okay, so we want to try to avoid all of this in the front end, but if we notice somebody may have an issue, how are we dealing with it? And Rosa, your case, it's got to be nipped immediately in the bud because of the fact that, your precious cargo is the children of the school. And at the same time, you also have your precious cargo, which is your employees.
Absolutely. I couldn't agree more with Barry. Our focus, as I mentioned earlier, we've been training our administrators, our principals, our AP, and administrators, even on school sites. And the focus hasn't been, here, I gotcha. there's a problem. The focus has been, we're here to support our employees and provide them the information, the tools, the resources they need. And as I mentioned, as a result, we tripled the number, which is scary, but we tripled the number of visits to our internal EAP in 18 from 17, just because of the increased awareness. Our employees are very receptive to our internal EAP because everything is done in a private setting. There's no communication back to the administrators, and we're having more employees reaching out to their immediate supervisor, having those conversations that themselves are asking for, a handout for the seeking of care opportunity. So it has been working out for us.
I just want to say one other thing. I think it's important to, to do as employers, to really do your best as far as vetting out certain facilities and making sure that where you're sending your employee is, not only a reputable place, but a good fit for that particular employee, because all programs are different.
Excellent. And Karen, it looks like we are just about out of time, and I have a lot of questions for both you, Rosa, and Dr. Berry. What I'm going to do for all of you on the line that I haven't gotten to your questions yet, we will provide these questions to the three panelists, and we'll get back to you individually on, your questions. And I think there's some great ones like plant-based, healing options that Jody Susan brought up, or, further questions that dig deep into, for you, Karen, how does an employee find out, which providers overuse, like opioid or use opioid sparing techniques. So I'm going to get these questions answered and out to all of you on the line. We do have our next topic coming up, which is the Affordable Care Act. Will it stay or go away? So we're going to take a brief 3-minute break. I am going to thank Dr. Berry for being on this call with us from his hotel room, Rosa Novo, Miami-Dade School District, for joining us via the telephonically from your office, and of course, Karen Van Kulo. We're so happy that you joined us as well. We can't thank all of you enough, and we're very, very much looking forward to getting more from you throughout the year. These webinars will happen monthly, and I do anticipate that this conversation is going to keep taking place. So thank all of you, and we'll take a brief break. And then for those of you on the call, we will be back on at 3 o'clock with the ACA Will It Stay or Go Away conversation. So let's take a brief break, water break, bio break, and we'll be back together. Thank you,
Thanks,
Rosa
Jenny.
and Dr. Berry.
Thank you. Thank you very much.